Well, that is one aspect of safety. The other on our Feel Good Breakfast show is we always bring information and how to take care of our families and even ourselves. I'm totally inspired this morning because I read this story and I also had a chat to Marion earlier this morning, and I need to share this with you. South Africans receiving free health screenings and counselling services. We're talking here measles and AIDS education. And I'm talking about an initiative, or call it a family, people that are taking care of us and looking out for us. Rotary Family Health Days, that's bringing free healthcare services to our communities. With us, the CEO and founder of Rotaries for Family Health and AIDS Prevention. I've got Marion Bunch here with me. Good morning and welcome to the show.
Thank you very much.
You're a ray of sunshine. You walk in here with your yellow shirts and you speak life, but it's not always about that. Tell me more. I mean, how did the Rotarians for Family Health and AIDS Prevention start?
Well, it began in the United States. I'm from Atlanta, Georgia, and my life took a huge curve when I lost my boy child, Jerry, to AIDS in 1994, early in the American epidemic when there were no antiretrovirals. Something like that, when you lose a child, absolutely changes your life. And I was a businesswoman and didn't do anything for about 3 years except mourn. And one day I got tapped on the shoulder by my son sitting in a Rotary meeting. And he basically said, get up and get going, Mom, you haven't done anything. And I'm sure he expected me to do something. So clearly, with not a particular vision, I just took one step forward. But the power of Rotary's brand and the fact that there are so many linkages between continents, ultimately this journey took me forward to Africa. And that's how I got to Africa.
I want to say, and it's the truth, you know, when you lose a child, it almost makes you want to not live on and do anything else. Instead, you're inspired and you take this forward. Coming to South Africa for the pilot year in SA, why did you choose us? Why are you coming here? And I say this because, you know, in the week I also learned of conferences that come here and that uses South Africa as their launch profile. You know, they use it as their launch city. Why Africa?
Well, I started this in 2011 in Uganda. It was the vision of a Rotarian, Stephen Mwangi, but he needed help. He needed partnerships. You know, nobody can fight this battle against AIDS or any of the other diseases alone. So we needed partners, we needed funding. So we have fabulous partners that began in 2011 in Uganda. It spread to Nigeria. It's now all over South Africa, Lesotho, Swaziland, and Ghana, where all 6 countries are providing free healthcare services to the citizens in the month of April. And the partners are what we need. Your Department of Health here has been phenomenal. They've made an unprecedented move in providing the medical services, right? The CDC, the U.S. government's involved through the CDC and USAID. They provide free medical services through the NGOs that they work with on the ground. In addition, the Coca-Cola Africa Foundation provides us funding so that we have enough to pay for the mobilization costs, not only of the Rotary clubs, but also of the communities. Then we needed media, without even asking, the SABC and Caxton, the newspaper chain. They both stepped up to the plate. So really, it's a model where everybody is donating services, but the Rotary clubs, 4,000 Rotarians from 225 Rotary clubs in this country are getting out these 3 days and providing free services, administering the sites, building the sites, managing the sites. They're the ones that are driving this.
I'm extremely inspired by your story because, let's face it, he's no longer here. Had it not been for your son, we wouldn't meet today and you wouldn't be spreading this amazing cause and also talk about it. The impact of all of this, I mean, Rotary Days in the year, you said it happens in April over all these countries.
Right.
What is the impact? I mean, I can see that the family and this organization and bringing even the countries together is absolutely amazing. What has the impact been? Well,
we're targeting 350,000 citizens this year. But last year, we achieved reaching 275,089 people in 3 countries. And in South Africa alone, it was 68,000 people. The main thing to get across that I'd like to get across this morning is that all diseases impact all families regardless of race or gender, continents, it doesn't matter, especially HIV. It touches everybody. And when you're young, you think you're invincible. So we want to get them screened and tested.
Access to healthcare, and I want to almost touch on what can people be screened for.
They can be screened for HIV, TB, diabetes, which is a critical issue all across Africa, hypertension. The children receive measles vaccination. At some of the sites, you'll have cervical cancer screens for the women. At some of the sites, you'll have dental screening, eye testing. So it varies, but the key ones are those annual screens that everybody wants. Yeah.
I can't believe this. It's amazing. Marion, thanks so much for coming.
Thank you
From
for
Atlanta
having me.
to Sea Point, man. You're in South Africa. Wow. Well, exciting news, and you just heard it. The health days are happening. We want you to know more. So go to our Expresso Show Facebook page. We'll put the details on there for Rotary Family Health Days. That's also their Facebook name. So Rotary Family Health Days. Also rfha.org.za. But we'll put all the information on our Expresso Show Facebook page so that you don't miss out on anything. Marion, thanks so much for coming.
Thanks for having me.
Wow. Thanks for coming to visit.
This
is your Feel Good Breakfast Show. We are making sure that we are informed and also that we bring a smile to you on this Friday morning. We'll be back after the break.